So thank you all for coming tonight. This is our first family health night with Voices of Tomorrow. We have our lovely panel here. We have Dr. Stobbe, and we have Nurse Ramla, and Nurse Mannheim. And our panel tonight is about vaccinations, immunizations, and the importance of it. The reason why we wanted to gather tonight is because we noticed that in our community and some of the families that we serve, vaccinations has been a really big issue this year. A lot of our families are simply, no, we don't want to get our children immunized. And I understand COVID came up and all of these different things are coming up and families are becoming a little more skeptical about why and if they should even vaccinate their kids. So we really wanted to gather tonight to have this open discussion about the importance of immunizations and the importance of vaccines. They've been around for hundreds of years, helped us eradicate so many diseases. We also see a rise in some of the diseases that have been gone. For example, MMR, measles, and polio. I think recently there's been a little outbreak of polio. And so we want to have this open discussion and answer any questions that anyone may have. First, we'll go through, and I think each person can introduce themselves and kind of their background and let us know a little bit about them. And then we'll jump into our question and answers, and you guys each present a little presentation that we can go through, and then we'll take it from there.
Well, thank you, and thanks for inviting me tonight. So I'm Gary Stobbe, and I'm a neurologist by training, so I'm a medical doctor and MD, and work with people with conditions that affect the brain and the nervous system. And I have been in practice for quite a while now, and I've developed, over the years, I've developed expertise and interest in conditions that affect how the brain grows, so neurodevelopmental conditions. The most common being a condition that we call autism, or autism spectrum disorder. And it's appropriate for me to be here because autism is a condition that is poorly understood. We don't understand it very well. And the way it comes on, it looks at times like it could be triggered by things in the environment. And one of the fears is being triggered by vaccines. So I'm here to answer questions related to that.
My name is Ramla. I'm a registered nurse for many years. I have experience in telemetry medical inpatient patients. I've also worked with COVID unit during the COVID pandemic. So that's mainly my background. And I'm here to talk about vaccines and any health concerns with the community. Thank you for inviting me tonight.
So my name is Jennifer Mannheim, and I'm a pediatric nurse practitioner. And my background is neurodevelopmental medicine, and so I've been practicing as a nurse practitioner for the past 20 years, and it's all been in neurodevelopmental medicine because I just love that population. And the past 15 years or so, I've really been focused on autism, and so I work currently at Seattle Children's Autism Center, and I diagnose and help support children and families there. And so I certainly counsel families often regarding concerns regarding vaccines, and so I'm hoping I've got some information to share with you today, and happy to answer any questions, and thanks a lot for inviting me.
So I think we can get started and jump right in. I think each panelist has an area that you're going to focus on. Is that right? Yeah. So we can go ahead and do that. Does anyone want to go first?
I have a question.
Okay.
Okay. Well, I think when we talk about vaccine, the most important thing is to first kind of understand what a vaccine is. So a vaccine basically actually helps your body or your immune system imitate an infection, so that when your immune system is later exposed to that infection, it's familiar with it and it knows how to fight it. That's the whole purpose of the vaccine. Sometimes it's normal to have minor symptoms with vaccines because that's your body imitating the infection. So, and then with children, there are certain vaccines we give during certain periods of their life, just to ensure they don't have debilitating conditions that has caused serious issues for, I guess, Americans in the communities in the past. One of them is like the polio vaccine. So with polio, it attacks your spinal cord, and it can cause paralysis, and it's extremely debilitating, and it can make it really difficult for you to walk. I know one of the concerns that a lot of Muslim and Somali communities have had is that with certain vaccines such as the polio and the MMR is about, I guess, the ingredients in it, whether it's halal. I did want to let you know with the polio and the MMR and stuff, it has been approved by very high level Islamic clerics. One, for example, is the Egyptian Grand Imam of Al-Azhar. He's actually an Egyptian cleric who is seen as a high authority on Islamic jurisdiction. And he actually encourages Muslims to get the polio vaccine. He doesn't just...
Jennifer, are you having a hard time hearing? Can you hear us?
So...
Yeah, I can hear you guys. Are you talking to me?
Yeah.
Yeah, I can hear.
Okay.
Okay.
It's so okay. Yeah.
Sorry, I know my voice is very soft and low.
Oh, that's even better.
Okay. So I was talking about the polio vaccine. It can affect the spinal cord. This was a huge issue. We've had epidemics before, which is why the polio vaccine came out. It can cause paralysis. It can cause where children have multiple surgeries throughout their whole life, and it is Islamically allowed for Muslims to have the polio vaccine. One Islamic cleric that has stated it is the Grand Imam of Al-Azhar, who is a major high-level Islamic cleric that has actually recommends and encourages Muslims, as it is our duty to get this to prevent debilitating illness on our children. I did also want to remind people about the MMR vaccine. So the MMR, it does cover mumps, measles, and rubella. You know, the mumps, it can cause deafness, swelling of the brain, and then with the measles, that can cause fever, cold-like symptoms, which can lead to seizures, and that's when it becomes life-threatening. With the rubella, if you are a pregnant woman and you get rubella, it can affect your child. And then they can be, mentally challenged or have birth defects. This is why these vaccines are very, very crucial. In 1995, they did have a group of Islamic 100 Muslim clerics actually have this discussion on MMR and polio and these vaccines, and they had this kind of a council or discussion with 100 Islamic experts, and they determined altogether that it is halal until there is even in cases of the MMR where there is gelatin, with even pork gelatin in it, it is determined by them that until there is another option, that it is still considered halal until there's an alternative. There was another council by the Islamic Society of Singapore, which actually governs or regulates anything Islamic related in Singapore, and they have also determined the MMR to be halal. And the reasoning for both these councils to determine that is that during the making of the vaccine, when they take the pork gelatin, they actually mix it with other compounds, and the gelatin enzyme is actually changed. So when the vaccine enters your body, the gelatin enzyme is no longer there. It is changed. So I just wanted people to understand that pork gelatin, it does not, that enzyme ultimately changes before it enters your body. So it is halal, and it has been determined to be halal by multiple councils.
Can you explain what you mean when you say change?
So the enzyme, they change it. So they add other compounds during the making of the vaccine. And when they add the other compounds, the enzyme changes. So it becomes diluted. It goes through a process of, I guess, hydrolysis, and it changes. So when it enters your body, it's no longer a pork gelatin. So I wanted people to understand it's halal Islamically speaking. So that is not one that is of concern.
Because it does, when it enters your body, it doesn't have that gelatin.
No, so
factor.
when it enters your body, it has already been, that compound has changed.
So is it considered to have?
So by the time it enters your body, it's been diluted and changed with other pure compounds, that it's no longer the same as a pork gelatin.
Okay.
Okay, so that's a very, very crucial thing for people to understand, that it is halal, ultimately. Okay, and then there is the DTaP is also one injection that is very important for a lot of people to get. I do not believe that has any gelatin in it as well. It does include a lot of 3 different kinds of bacterial infections. I want to say them correctly, but diphtheria, pertussis, and tetanus. Tetanus is when you cut yourself, you step on a nail. It can actually, it can be very debilitating. So a lot of times when we have these vaccines early on, it prevents a lot of illnesses. People, in the old days, usually just died younger because of illnesses like this. And if you see that, currently we are living longer than, our ancestors did. And one reason is vaccines. And then I did want to also address the COVID vaccine. I know there was a lot of concern about that. There are multiple different vaccines, and they have different components in it. And it is a monitored system. They do now have something called the VARS, which is a monitoring system for for the COVID vaccine. There's currently 4 out, but I believe we just need 3 right now for people who are not immunocompromised. For the VARS, it does monitor the side effects that people get of the vaccine, so that they can make sure that everything stays safe. Is there any other questions people have? Go ahead.
I think this question, I don't know if you can answer this question, but for children, does getting a vaccine at a young age, like, 4 months, 6 months, up to 4 years, how does that affect them mentally or their developmental growth?
Oh, okay. I don't know if this is a question for me.
Yeah, I'll address that.
Go ahead.
Okay. Any other question?
So, just going back to the whole gelatin thing, a big concern, and it's actually something that's been vocalized a lot, is our families are saying, no, it has gelatin. It starts off as gelatin, it is gelatin, it's entering my system, it's gelatin, I don't need to get it, my child is fine. My child is fine, I don't need the vaccine, so what?
What those families need to understand is that is when the actual vaccine no longer has the gelatin is already diluted and mixed with other compounds, that it's completely changed. So it's no longer would be considered gelatin.
Yeah. So what happens if, for example,
And this is not I did want families to understand, this is not a ruling from me. This is from not only Muslim doctors, but this is 100 Muslim clerics that have stated this. So it's not just coming from me.
So I have a 5-year-old, right, and say he's in the program. So if my child is not immunized and he gets measles or mumps, for example, and he comes to school, how contagious is it?
It's very contagious. Okay, so all the conditions that kids are being vaccinated, every single one or almost every single one would require isolation because they are all contagious.
So going off of that question, if my child is not vaccinated and they do get measles or something like that and they get over it, can they come back to school without getting vaccinated?
Yeah. Well, actually, that's more of that seems more of a school or administration issue.
Should we recommend that student to get vaccinated so nothing happens to the other kid?
I guess stemming from that, can you catch it more than once?
You can catch anything more than once.
I mean, yeah. Well, I think with that last question, I don't know the specifics on the rate of second infection. Certainly, when you do get a natural infection, that would, if you have a working immune system, that would then give you immunity to fight off a second infection. And I would think that the question before about your child being allowed in school, I do think they would be allowed after they were no longer infectious. But I'm not sure how long that period of time is. Jennifer, do you know that at all?
I couldn't quite hear the question, but you said the question is how long are you infectious after you've been infected by COVID?
Measles.
Measles. So the question was, if you had the question,
I
if you
guess
had
that
like,
wasn't my question
Oh.
exactly. My question was, because this child has had measles before and they're not vaccinated and their parents are, for example, a Muslim family who doesn't want to get their child vaccinated due to the fact that it has pork, but they have other children in the classroom.
Yeah.
How would that work?
So it sounds like, Jennifer, the situation, the example was if a child has had measles already, and the family chooses not to get the vaccine, would the child be allowed to attend school?
Yeah.
Do you know the official rule on that? Would that be school by school or district by district, or is there like a?
So I think that there are, first of all, one option is to have what's called a titer done.
Right.
So that's where they take a small, you want to explain that, Gary, or?
Yeah, so you can see if you actually have immunity. You can give a blood sample and they can measure the protein that helps you fight off the infection. So I would think if a kid had evidence of immunity, because either from a vaccine or from the natural infection, that child would be allowed to attend school, I would think.
Absolutely, yeah. And I think in Washington State, there still are some options for, if you have other medical reasons that the person can't receive the vaccine. Although I think in California, there's some states where
I know the vaccine with the schools is state by state. I know the laws are state by state, so it depends on this is a Washington State Department rule. But as long as they pass their contagious, period, there's no, medical reason.
Did that answer your question? Was that
Somewhat.
Somewhat, yeah.
Yeah.
I feel like there's still some more.
Mm-hmm.
I mean, do you want a follow-up question?
Yeah, I guess my thing is, we have a lot of students who are not vaccinated.
Okay.
And that's concerning for the other kids in the classroom.
Right. Exactly.
How, as parents with kids who are vaccinated, how can we protect our children when there's people coming with no vaccine? Like, you getting sick affects the other children, our children. So you vaccinating your kid is gonna help every other kid.
Right. So if I can restate that.
And it always connects to like developmental. I don't want to vaccinate my child because my child is gonna be.
Well, there's different perspectives, right? There's the perspective of the person that is concerned about administering the vaccine, right? So that person might have a child that isn't vaccinated, right? There's the perspective of the other family that is more concerned about their child getting the disease, and then maybe that child has been vaccinated. And I would say there's a third perspective that you could say is the public health perspective, right? That's trying to prevent, a condition from rising and infecting more people. Though all of those perspectives don't always line up. And that's why this is controversial, right? And that's why there's disagreement. And I think it gets into policy of where you have to speak up, right? And people, if you believe strongly in one of those viewpoints, you have to represent that viewpoint. I don't think that there's not going to be a natural law that's going to decide this for you.
So how do I think this question still goes to you?
Yeah.
How does vaccines and developmental connect?
Yeah, that's a great question.
Since they start at a young age,
Yes, great question. So the growth and development of the human brain starts while the baby is still an embryo inside the mom. And that nervous system then is rapidly growing during that stage, and continues to grow just like amazing. You can imagine a tree just growing, blossoming through childhood, all the way into early adulthood. The brain is still growing. The brain then changes in adults as we learn and as we change and as we live. But the development, a lot of the brain development is wired by our genetics. So it's pre-programmed to grow in a certain way, right? However, growth of the brain is also influenced by what you feed the brain with. So if you have a brain that is learning, is able to be around people and practice activities, it's going to grow even better, right? So you have both the genetics, the pre-program, and then you have the environment. And diseases or injuries to the brain can impact how the brain grows, absolutely. So if you were to have an infection with let's say a virus that gets in the brain, or if you're in an accident and you have trauma to the brain, or you have a disease that makes blood clots and you have a stroke to the brain. All of these things will affect both how the brain is functioning at the time, and it can often affect how the brain will grow in the future. Right? So we worry about infection getting in the nervous system, in the brain, and affecting the development. And there are examples of rare events where a vaccine can trigger such a reaction that it can also cause damage. So we know those cases. They're very rare. What has gotten into the news and into the kind of the popular belief is that vaccines are causing damage at a much higher rate than those cases that I'm talking about, these rare cases. So the fear is that it's way more common, right? And one of the biggest fears came in the 1990s when we started to see the rates of autism really going up. So we started to see a rapid increase in the rate we were diagnosing autism. And it was around the same time that you started to see more vaccines. So that's puzzling. There's also with autism, there's about 1/3, about 1 in 3 kids that gets diagnosed with autism. Their pattern of autism is such that they, around age 18 to 24 months, they can lose some skills. So they can start to develop words and then lose some of the words. And it looks like they had an injury to the brain or an infection to the brain or something happened that triggered it the way it does that, okay? Now, it turns out that those people they had autism already. So they're
younger than 18 months.
younger than 18 months. So there was a pivotal study that was done in, actually from University of Washington, actually, early mid-1990s. They took kids that were being diagnosed at age 2 to 3, okay, where their parents were only seeing the symptoms of their autism, at that age. And they went back and were able to they looked at their 1-year-old birthday party videos. And they had clinical experts look at the videos without knowing whether they had an autism diagnosis or not. And they were able to recognize the symptoms of autism.
And what are those symptoms?
So,
At like age 1 and under.
yeah. So they're subtle. They're not nearly as easy to pick up.
Mhm.
So, and they will often be not making as much eye contact, or not showing off things when they get excited, or like seeing a plane up in the sky and getting excited about the plane and then looking to their mom and like to get their mom's attention to look at the plane and things like that. So they could see evidence of this at a table around their other little kids, and not paying as much attention to the other little kids as the typical human does at that age. So this led then to a lot of further studies that have been done in the past 15 years using advanced methods of imaging the brain. So using MRI scanners, but with techniques that are kind of research techniques and are not typically what we use. And they did them on very small babies. And they did them on babies that had not been diagnosed with autism yet. But they were siblings of kids with autism. And we know that siblings, because there's a big genetic influence on having autism, about 20% of boys, if you have a son with autism, you have another son, that son has a high risk of having autism, about 20%. So they took those babies from birth before they got diagnosed, so 80% of them are not going to have autism, right? And they followed them and they did this imaging, and they were able to show in the first 6 months with the imaging differences in the brain between those kids that were going to go on and have autism and the kids that weren't going to have autism. So these changes, so it's like me looking at a tree that's growing, and if I don't have great techniques to look at it, I might think it's going to be normal. Then it grows and it doesn't grow as well. But somebody that studies trees and can really maybe test the tree might have been able to predict that at a much earlier time. So we're learning that. We're learning what we thought, which is most cases of autism are predetermined from genetics, even before they get to those ages, right? Now, that doesn't mean that it's not important for the child with autism to be healthy. Again, the best tree is going to be fed well, right? And so, giving the child an opportunity to learn is going to still influence the growth, right? So you don't want to forget about what you're doing. You don't want to just say, oh, it was this way, it was going to be this way. No, what we do with children influences whether it's a child with autism or not. What we do and what they're exposed to and what they learn is going to be how it influence their brain as they grow up.
So many people might consider for example, the eye contact and the playing. Some normal people and parents, especially immigrant parents, might consider that normal.
Yes.
Like this is what normal children do. So what should a parent, because we know some children in our programs, in our schools, that are 3 years old, 4 years old, that show symptoms, but parents consider it normal.
Yes.
So what is normal at,
Yeah.
like for example, 1 year old, 2 years old, up to 3 years old?
this sounds like a good question for you, Jen.
Yeah,
So I'll repeat the question. So
stating it.
yeah, so I'll repeat the question. So there are many families that have children in which they feel that maybe eye contact is normal, even though maybe someone else is saying, oh, it's reduced. Or they might say, oh, this child is talking late, that's okay, we're not worried about that. That's what he does, or he or she does. So the question of like, what is the range of what we consider normal versus going off the normal developmental pattern, let's say with eye contact or with some of these other things that you are accustomed to?
That's an excellent question, and there isn't necessarily one, like if you maintain eye contact for a certain number of seconds, a certain percentage of time, that's necessarily what's considered normal. Eye contact is really, you say, subjective, right? So it's just kind of like if you're looking too long at someone, it feels awkward, right? And if you don't ever look at someone, that feels awkward too. So there's somewhere in between is the range of normal. I think the main way I want to answer this question is that there isn't just one symptom that we use to diagnose autism. It's actually a collection of many symptoms. And some kids with autism can be really good at making eye contact, and there's nothing unusual about it. But they are really struggling in other ways of communicating, and eye contact is something we'll call it's a nonverbal gesture or way that you communicate and show you're listening to someone. So we're also looking at other gestures I use. Right now I'm using gestures. I'm waving my hands and I'm describing things. I'm smiling. That's a gesture. So it isn't just one thing, but I have this conversation with families on a regular basis because eye contact can change culturally. Certainly it's not in certain cultures, right? It's okay for a man to make eye contact with a man, but not for a man to make eye contact with a woman in the same way. And so when we're thinking about autism, we're taking all of those things into account. And another thing I'll say about eye contact is often I find that the children themselves make pretty good eye contact with family members and people they're comfortable with, and they don't use eye contact in the same way with people outside their family. So often within the family, they're like, they're fine, there's no problem. But then as we kind of evaluate, we realize, they aren't able to generalize that skill. So I don't know if I fully answered the question, Gary. Was there another part to it? Or
you got a thumbs up. You got a thumbs up on that. So that was good. Yeah, and I'll add a thing on the cultural thing that I think is worth kind of pointing out because it's irritating to me, and it's got to be irritating, to other cultures. Is that so many of our tests are standardized on the white American culture, right? And because these biases are culturally based, our normative tests might not exactly fit. And we've actually seen this also with in autism with the way between boys and girls. Tests were also originally designed for the way boys are presenting. It turns out that girls often present a little different, but the testing that often misses it. So I think that it's really good to recognize another really important point about the diagnosis of autism and all of these developmental conditions is we don't have good tests. We use the best tests we have, but they're still not that great. They're not like a blood pressure or a glucose in your blood where it's like really accurate. Jennifer and I get jealous of our colleagues that are like kidney doctors, where they've got these tests that just measure things down to the milliliter. So we have to recognize that. We have to recognize that that's a weakness. And I had an email this morning with a family, a 3-year-old, and they have gone through 3 different evaluations and their child has not tested within the scores that we consider autism, but the family's still very convinced. And I have to honestly say, if you look at studies, we're wrong 10% of the time in 3-year-olds. Maybe this is one of those 10%, right? And so you have to be honest about that, about the things that we don't know, right? I think that, and I'll take that back to vaccines and autism. There have been a number of studies, very high quality studies that have been done on a population level that show vaccines are not a risk for development of autism, which is great. It makes us feel much better. But I worded that very carefully. I said population studies. Is it possible that one person might get an illness from a vaccine and it might, contribute to something going on in the brain, and maybe that turns out to be autism? Yes. We can never rule out 100% on things like that. So we have to take what we know. We have to recognize that we don't know everything, and we just have to we have to do the best that we can, with that. So
I think there's the ladies in the back have some questions.
Yeah.
Oh yeah, I talk a lot. Sorry.
It's okay. So if a pregnant woman was to unknowingly get, or if she didn't know she was pregnant but she got a vaccine, would the child get a vaccine too, or would it harm the child?
Oh, that's a good question. I'm going to probably plead ignorance on that. I'll repeat the question, make sure I heard it, and then Ramla, you can maybe answer this. So I'll repeat it. So question: if you're a woman and you get vaccinated, and it turns out you were pregnant while you didn't know you were pregnant, right?
Mm-hmm.
And you get vaccinated, would the child be vaccinated also? Is the question.
So the answer is no. The child will not be vaccinated. And then the pregnant woman, whether you should get the vaccine while you're pregnant or not depends on the vaccine, and that is determined by your medical doctor.
Would it affect the child in any way, negatively or positively?
Like I said,
Yeah.
it is
Sorry, I'm gonna pick up.
Yeah.
Certain vaccine, your medical doctor will not advise you. They will advise you to get the vaccines that are appropriate for you, and those should not be harmful to you or the child.
Yeah.
In the best way possible,
Yeah.
So leading to that question.
So Jennifer, she asked that if would the child be harmed by a vaccine the pregnant woman received, and
Could that affect
could that affect them?
the child?
Could that affect the child?
question is if a pregnant woman receives a vaccine, would it harm the baby? Is that what you're saying?
Yes.
Yeah. So, there was some time ago that the flu vaccine had a preservative in it that contains some mercury, and preservative is called thimerosal, and there has been concern that's been disproved. But in 2001, they went ahead and removed thimerosal from many vaccines, and then with the flu vaccine, you can actually get it now without thimerosal in it. And it is recommended that pregnant women do receive those vaccine, the thimerosal free vaccine. But from what I know, it's not proven that necessarily would affect the fetus. I think the bigger concern is if the woman were to get sick, say a pregnant woman got sick with COVID or got sick with a disease that would put their body at stress, and that would impact the fetus. So there's greater risk for them to be sick with the disease than there is for them to have a reaction or response from the vaccine that impacts the fetus. Does that make sense?
Yeah.
Yes.
Did that answer the question as well too?
Yeah, that was great.
Yeah.
That was very helpful. Yeah, you're getting lots of head nods. Lots of thank you head nods.
Lots of head nods. Okay, all right, good.
Other questions? Or do we want to?
No, I think we're gonna jump into, I know Jennifer, you prepared some information for us, right? I don't think she can hear me.
Yeah, Jennifer, do you have any prepared information that you would like
I
to?
do.
Yeah, let's hear it.
All right, you want to hear mine? Okay, I even made some slides when I was waiting to log in. I was like, I'm just gonna create some slides. It's who doesn't like a good slide? Well, I can't claim it's a good slide, but Oh wait, here, maybe I have.
I like your hand motions, but a lot though.
And hand motions, can't see my hand motions when I do it, though. That is kind of like too bad. Alright. So are you able to see my slides?
Yes, that's great.
Excellent, okay. So this is about vaccines and autism. Jennifer Mannheim, ARNP, Seattle Children's Autism Center. It's a very official title. Let's see here. Here we go. Okay, so myth number one that I was asked to talk about was vaccines causing autism. And Gary already talked a little bit about this, but I'm gonna go a little bit deeper, and I added some photos. I think I did. We'll see here. So this goes back to this person. So I'm gonna tell you a little story about this guy named Andrew Wakefield. And so he was a gastroenterologist, academic gastroenterologist, which means he did a lot of research, and surgeon. Here, I put in a little bit of information in case some of you want to read along. But basically, he was a British doctor, and he did a lot of research with a GI disorder called Crohn's disease, and he discovered that it was caused by a decrease of blood flow into the intestines, which is pretty groundbreaking information. He got really interested in the measles, mumps, rubella vaccine, and actually did some research looking at MMR, measles, mumps, rubella vaccine in relation to Crohn's, and found there wasn't a relation between the vaccine and Crohn's disease. But then in 1995, he was approached by a group of parents who felt that their autism was results of the MMR vaccine. And so they asked him to look into this connection. These parents were actually in the process of a lawsuit against the British government, I believe, looking into this. And so then Wakefield kind of went along this theory that if the measles vaccine had caused inflammation in the intestine, then the children could develop this like leaky gut syndrome, making it possible for harmful proteins to make their way to the brain. And if this occurs, it's possible that this vaccine caused autism. So that was his running theory. And he did some research, and then in 1998, he, as well as 12 of his colleagues, published this article in this very premier medical journal called The Lancet. And he claimed that in his sample size of 12 kids, he was able to prove that this MMR vaccine was causing autism. And after this, it of course led into this big explosion of research done around the world, with lots of people looking at this, and kind of back to what Gary was talking about, these populations based studies. And no one is able to replicate any of this information. And so then in 2010, after going back, 10 of the people who were involved in the initial publication of the story, or not the story, the research, found that there were some elements to the paper, data that was shared that was actually incorrect. And so they ended up retracting the article, so taking it back and saying, actually, we supported this article, that's actually, information isn't true. And Wakefield and the group were found guilty of ethical violations because they conducted these investigations on children without obtaining consent or ethical clearances. I guess they had consent, but not ethical clearances. And then they had this misrepresentation of the data. So they were found guilty of fraud. Actually, Andrew Wakefield lost his medical license. All these things happened as a result of that. And it was also appeared to be a financial gain. So he got his research funded through these parents who were trying to sue the government. And so there was a lot of ethical issues that were going on. But the damage was already done. People were already worried that vaccines cause their child's autism. And so it's important to know that a lot of the people who were involved in that initial study did pull their information back and realize what was going on. There's many books I've read that have been published about this where they actually go into detail into those findings that actually really didn't support the data. But again, once you release that out into the environment or out to the world, that's what's caused a lot of concern about the MMR. But then number two was concerns that vaccines aren't safe. And again, this gets to a lot of misinformation that gets put, especially in social media these days. It's like somebody has an idea, they post it, and all of a sudden it becomes like truth, but there isn't any facts behind it. Specifically for measles, mumps, rubella, Gary Stobbe was talking about this earlier. Sometimes what's confusing is that the timing in which you get a lot of the vaccines is early in the first 2 years of life. And that's often before the autism is diagnosed, as Gary was saying. But that if they went back and looked, they could actually see some signs of autism prior to those vaccines. But parents often looking back, they'll remember an event and then they kind of think before and after the event. And vaccines tends to be one of the ones that they look back to. So it's kind of like guilt by association because these two are happening around the same time. And then sometimes families feel like one caused the other thing, as opposed to them just happening around the same time. But for the most part, vaccines are considered safe. As Ramla was talking about, there is this whole system, this VAR system that anybody can put information into. So if you're a parent who feels like your child was harmed by a vaccine, you can actually put your information into that system, and it's all collected. And the Centers for Disease Control monitor all this information, and so this is looked at on a regular basis. And the cause of harm, especially from the measles, mumps, rubella vaccine, is less than 1 in a million. True harm, like death or that type of thing. The most common are like what Ramla was talking about, that they have redness, swelling, can cause a fever. And sometimes a fever, if a child has very high fever, it could be related to like a febrile seizure, which is not life-threatening, but certainly scary. And so sometimes when these events happen, there's this association that these vaccines are unsafe. But the truth of the matter is the kid had actually got measles prior to there being a vaccine for measles, mumps, rubella. Like hundreds of children died every year, 300 to 500 or more would die every year. So there's definitely a sense that it's preventing death, but still risky. There's still some risk with any vaccine, medication, driving a car, anything that we do, but they are relatively safe. Myth number 3 was vaccines contain toxic ingredients. And I was just going to refer back there, mercury was a big one that was of concern, as I mentioned before. And so a lot of work was done by the Centers for Disease Control to really tease out, there's 2 different types of mercury. The one that you get when you eat fish, which can build up in your system, and the other kind is the ethyl mercury, which was used in vaccines as a preservative. It was never in the measles, mumps, rubella, or in polio, or most of the vaccines that we got that children were given, but it was in the flu vaccine, and so that's been removed, and was removed back in 2001. Yet the prevalence of autism still has increased. An interesting study too. I was reading that up in a very rural part of Canada, where there's a native population, and they eat a lot of fish and have actually quite high mercury levels. They don't have any people in their community who've been diagnosed with autism. This was a few years ago that I read this study, so it's just an interesting thing. Because for a while it was thought that the mercury was causing autism. And then the flu shot causes the flu. And I've certainly heard people say, I was fine, and then I got the flu shot, and then a few days later I got the flu. So it must have been from the flu shot. And again, there's like an association. But it's also, so the flu shot doesn't cause the flu. You might get like a reaction as you would with any vaccine, a fever, redness, swelling, because you elicited an immune response. But it's also possible the person was actually exposed to the flu. And developed the flu, so it would happen regardless of getting the vaccine or not. And those were the slides that I had prepared. Stop sharing the screen here. So hopefully I didn't talk too fast, and hopefully some of that made some sense. But I'm certainly interested if anyone had questions, happy to talk more or go back over anything.